You know, what I was feeling was the loss of the ability to have a normal life, really. I'd have to stop and sit down and rest because I was getting lightheaded. They told me that I would know when it's time because I had been monitoring this with the cardiologist for a number of years. This wasn't a surprise to me, you know. And so I got to a point where I just said, it's time, because it was really interfering with the things that I like to do. You know, the condition was just really interfering with what I like to do. You know, I called up, get me an appointment as fast as you can, and put me on the fast track, and they did. So I think from the time I actually called and said, you know, put me on a fast track, I had the surgery within 2 weeks. So, you know, my first impression of meeting Dr. Engstrom was he was extremely professional. He answered all of my questions and my wife's questions. There was never a point at which I felt that I was, you know, just being like just part of the system. I felt that there was a real individual care and a real individual connection there with not only Dr. Engstrom, but the staff as well. I think the trust in the surgeon came from, as I've just mentioned, they answered all of the questions. They answered all of Lindy's questions. And, you know, some people might take this as being bragging or boastful, but the doctor said, I'm very good at what I do. And I appreciate that. You know, you know, he has honed his skills for a number of years. And I think to expect anything less would be a surprise. But for someone to say, hey, I'm really good at what I do, and every stitch I make is exactly like the stitch before, and they're all the same tightness. And I walked out of there going, hey, this is my guy. This is my guy. You know, I think as the patient, we may feel a little more comfortable putting our care in his hands, but my wife, Lindy, was there at every appointment. And it was really her confidence. He was instilling his confidence in her as well, because, you know, when your loved ones don't feel comfortable, you know, you're in the process, you're in the groove of it all, and everything is happening to you, and you're going with the flow, but they're on the outside looking in. And so it was as much instilling confidence in me, but also in my family. Yeah.
So that was 5 months ago. Tell us about how are you today?
So 5 months ago, August 11th, is when I had the aortic valve replacement. Today, hills fear me. Stairs fear me. I've got my old stamina back. You know, I'm not 35 or 40 anymore, but yeah, I totally feel like a different person. Yeah. Just how much I appreciate his skill and his caring. He was so good with the flow of information. After the surgery, I mean, within minutes after he finished his part of the surgery, because it's a team, let's face it, he was texting Lindy, everything is great, everything is okay, Bob did fine. You know, it couldn't have gone better. And again, it's instilling that confidence in your family and your loved ones, because quite honestly, you don't know what's going on. You know, you put your trust and your faith in their hands, but it's just really important. And he was so good at communicating and getting back to us right away if we ever had a question. Either he, sometimes directly, or his staff. It was fantastic, really.
Nice.
Thankfully, you know, I went into this in pretty good health. And I you know, these people are professionals but they're not magicians. They can only work with what you bring to them. And the better health you are coming in, and the more you're willing to make changes on the backside, it's like Vince Lombardi once said, it's all about attitude.